Hello, I'm Dr. M. Welcome to VMC. Today we're diving into the world of MDR1 mutations, which is something that every dog and cat owner should know about. Join me to learn how this tiny mutation can have implications in your pet's lives. You'll learn something today. First of all, what even is MDR1? Well, that stands for multi-drug resistance 1, and it stands for a mutation that an animal inherits that makes them more sensitive to some specific medications and drugs that we use in veterinary medicine. The genetic variant is in their ABCB1 gene, which was formerly known as the MDR1 gene. This variant causes a change in a protein called P-glycoprotein. Each dog inherits two copies of this gene, one from each parent. So the ABCB1 gene codes for the production of this P-glycoprotein. Interestingly, this protein was originally discovered in cancer cells. During research, it was found that some lines of cancers were resistant to certain drugs that we were using to try to fight those cancers. Further testing showed that those resistant cancers contained this P-glycoprotein, and this protein sits on the cell membrane and it pumps out the chemotherapy, and this is how the P-glycoprotein helped those cancer cells to resist the chemotherapy drugs. Over time, researchers found out that P-glycoprotein is actually a component of normal cells, just like it is in some cancer cells. And in normal cells, P-glycoprotein will remove toxins and different medications from the cells, just like the protein was doing to chemo in the cancer cells. We then also found out that P-glycoprotein is an important part of the blood-brain barrier. The blood-brain barrier is what we call this filtering mechanism that helps to keep things that are inside of the blood outside of the brain. In dogs that have MDR1 mutations, their P-glycoprotein is not functioning properly, and the result of this is that different medications or toxins or substances will build up inside of the cells and then will be more likely to cross the blood-brain barrier than they would be in dogs that have a normal P-glycoprotein function. And it was in 2001 that Dr. Katrina Mealy discovered that there is this mutation in dogs. It was first discovered in collies and other herding breed types. As we have done more and more research on the topic, we found out that there are other dog breeds as well as cats that can also have MDR1 mutations. About 75% of collies will have this mutation, about 50% of Australian Shepherds, and then other herding breeds are a bit less likely, but still more prone than non-herding breed dogs. So what symptoms are you most likely to notice if your dog or cat has an MDR1 mutation? Well, the most common signs will be when a dog or cat has a drug toxicity because they have that MDR1 mutation. We might see vomiting, weakness, uncoordinated movement, tremors. They might also end up having seizure activity. If it's a very severe reaction, they might experience blindness and rarely but possibly even death. These neurological signs are because of that impact on the blood-brain barrier, meaning that the medication or drug is getting into the animal's brain and not being cleared in the manner that it usually would be. Now, P-glycoprotein does impact the distribution and the amount of time that the drug stays in the cell for many different drugs, but there's only a few that tend to cause clinical symptoms or problems. The one I get asked about by far and away most frequently are different heartworm prevention medications. What's important to know is that at the FDA approved doses, these medications like ivermectin and selamectin, etc., will not produce symptoms in a dog or cat that has an MDR1 mutation. It will only cause problems if it's given at too high of a dose. So the most common reason that veterinarians will see herding type dogs have MDR1 mutation symptoms is when the people who have these dogs are trying to save money and they will take medications like ivermectin that is formulated, say, for livestock, so at a much higher dose and concentration, and then they will try to calculate how much they should give their dog, and they will either miscalculate or draw up the wrong amount and give their dog the incorrect correct amount, it will be too high of a dose, and then that dog will suffer the consequences because of it. This is one of the very many reasons that for things like heartworm prevention, it is incredibly important to use the medication that is for that specific species, and to not do things like splitting doses or using medication designed for other species in order to protect your pets from heartworm. I did have one patient a number of years ago now who actually presented with symptoms of MDR1 toxicity, and it was after that dog had gone and eaten a bunch of poop from this person's horses that had just been dewormed with an ivermectin product. I've also read of other veterinarians having the same problem, so be aware of what medications are being used on livestock and horses, and be careful, because if your dog is eating horse, cow, sheep manure, there is a possibility that they could be ingesting enough of the drug that it could impact them. There are some other medications that are commonly used as part of a properly planned anesthesia event that may impact dogs or cats that have MDR1 mutations. Most commonly, things like aceprobenzene and butorphanol can be implicated here. However, at the doses that we use in clinic, it may just mean that it lasts a bit longer for your dog. It tends to not have any long-lasting or serious complications. However, in herding breeds or in an animal that we suspect has an MDR1 mutation, we'll tend to dose them at the lower end of the dosing range just to be careful. Another class of medication that you do actually have to be careful about are chemotherapies. Some chemotherapy drugs are more likely to cause more severe side effects in animals that have an MDR1 mutation. This most often looks like GI upset and bone marrow suppression. So if you are dealing with chemotherapy in your pet, it's something to talk about with the oncologist if you know that your dog has an MDR1 mutation. One medication that needs to be avoided at all costs is an anti-diarrheal medication called loperamide. It's sold under the brand name Imodium. Do not ever risk using it if it's a possibility that your animal has an MDR1 mutation. It's also just important to remember that drug interactions can also impact how those drugs affect your individual animal. So always make sure to talk about possible interactions between different medications with your veterinarian, and don't ever start or change medications without consulting your veterinarian first. So how do we diagnose an MDR1 mutation? Well, the only definitive way is through genetic testing. The ABCB1 gene encodes for P-glycoprotein and determines its base level functionality. An animal may be severely impacted with drug sensitivities if they inherit two variants of the ABCB1 gene, as that means that that animal will only have abnormal P-glycoprotein function. Animals that inherit one copy are going to be less severely impacted than those that inherit two. There are commercially available genetic tests that will look at blood samples in order to check for ABCB1 gene mutations. To be real with you, in a vet clinic, the most common way that we find out about it is because a young animal ends up having an unexpected reaction to a medication that we use. But of course, in that situation, all we can do is suspect an issue. We can't actually make a diagnosis until we do the genetic testing. At this point, there is no antidote or cure for MDR1 gene mutations. All that we can do is decrease the dose of medications where we can, and or choose a different medication option when one is available. If an animal does experience an adverse reaction to a drug, then we give them supportive care and make changes to their treatment plan going forward. There is ongoing research that is looking at the possibility of a P-glycoprotein substrate. We'll see what happens. Maybe one day we will have one that we can give to patients with this mutation. The good news is that with proper consideration of medication dosages and interactions, most animals that have MDR1 mutations live very normal lives and they never have any problems because of it. I know that people really commonly stress out about this MDR1 mutation. However, in the veterinary world, we're very aware of it. We take it into account, and this is part of the reason why we are such sticklers about using medications designed for the appropriate species and given at the appropriate dosages. Thank you so much for joining me in today's video and for taking your pet's health so seriously. I do put out a new video most Fridays and cannot wait to see you in the next one. If you have a topic you'd like me to cover, don't hesitate to comment it down below. I do love to hear from you, and YouTube thinks you'll like this video. I hope you have a fabulous week. Bye! It is incredibly important to use the medication that is for that specific species